care facilities have been hit hard by this virus. In the St. Louis region, we've had over 115 outbreaks. And you know what? I'll take my mask off so I can talk here. In the St. Louis region, we've had 115 outbreaks. 74 of them have been in St. Louis County. Our Department of Public Health began working with our St. Louis County Emergency Management operation and recognized that our long-term care facilities, our nursing facilities would be a place that would need some extra attention. So we developed a high-risk task force of volunteers, retired physicians, other medical professionals that could help us keep track of what was happening in our nursing facilities. And what they do is they each have assigned facilities. They check on them on a regular basis. They provide them with educational materials, PPE, and anything else that they need. If we have an outbreak in a nursing facility, a senior living facility in St. Louis County, then we have another group, our quick response team, public health officials, epidemiologists, other folks on our team, and they go into that facility. They provide testing, PPE, educational materials, and a deep cleaning, and they can do all this in 24 hours. So far, we've distributed 30,000 masks and other PPE to our senior living facilities and our nursing facilities in St. Louis County. Earlier this month, our emergency management operation was notified that the State Emergency Management Agency, along with the State Department of Health and Senior Services, was working to emulate our quick response team and our high-risk task force and to apply that statewide. And that's what we're here to talk about today. Our quick response team and our high-risk task force is now a regional effort. We are cooperating with the public health departments of our neighboring jurisdictions, counties, and St. Louis City. We are cooperating now with our health systems who have joined this effort, and we now have been recognized by the federal government, the Center for Medicaid and Medicare Services, as a model for our country, as the right way to take care of our nursing facilities and our seniors. We are currently gathering the information of the nursing homes in St. Louis County that have had an outbreak and the number of cases in each facility, and we'll be making that available when it's collected and in a way that it can be reported. I believe that our response here in St. Louis County, our focus on seniors and on nursing homes, has saved lives. It was quick and alert reaction from our public health department, and it is really a testament to the good work that they do every day for public health for the residents of St. Louis County. I'm glad that Governor Parson is here to join us today, and I'd like to recognize him if he wants to make a few remarks. Governor.
Good morning, everyone. It's good to be here in St. Louis County, good to be here in the St. Louis region. I think, frankly, on March the 7th where this all started for the state. When I was here that evening, I think late for all of us, we come in to be here. I want to thank Sam for the job he's doing here and for what he's doing here in the county and for what you've been going through here in this part of the state. It's been tough up here, to say the least. A lot of people's worked hard, and I was talking to Dr. Page before we come out here, and we were kind of recapping a little bit about where we were on that March the 7th day when we were all trying to figure out how to handle this situation. And I know for the governor's role, you know, I was trying to do a blanket policy, trying to cover the entire state of Missouri, not knowing really where this effect was going to take us, where this virus was going to take us. And really what we did is we just deployed everything out, and we were very thin everywhere in the state of Missouri. As time went on, thank goodness to good leadership, good healthcare systems in our state, especially in this region of the state, healthcare departments, we were able to kind of analyze where did we really need to start targeting, where do we need to start putting our resources together. And as Sam mentioned a while ago, when you talk about the nursing home, we seen right away that was going to be a crucial area that we were going to have to do a better job of making sure we protect those people in those nursing homes, plus the employees, and frankly, how we were going to deal with that situation. But what we soon learned was you had the nursing home situation that we had to deal with, we had the food processing that we had to deal with, You know, we had people incarcerated that we were having to deal with, a lot of things that we could target our resources with. And frankly, we got better and better. One of the turning points in the state for the governor's office and for our health department is when we started getting official data from the state of Missouri. When we started, at first there was a lot of inaccurate information out there on the national level, but I think the thing that helped us most was when we were coming back to the state and see the data here. And we used that by helping with the infectious disease experts, 10 of them that we've been in communication with now for 10 weeks, I believe it is, that we've talked to them, getting their advice, and some of them here in the St. Louis region that's been on that call with me every week. But moving forward, we're putting most of our resources right now, a lot of our resources, I want to say right now, on testing for multiple reasons. One, to be able to make sure that we can test prior to having a problem, especially in our nursing home arenas, that we're going to be able to do a better job of that. Trying to provide the material to be able to test on a large scale. One of the things that we were all trying to do from the administration branches, we're just trying to get the material out there to physically do the test and then get them performed and get the test results back, which is another issue we got to deal with. But those were some of the things early on we were trying to deal with, and now we're finally getting those pieces put together. We can do large volume. So last week from the state level, we actually instituted a team at SEMA that has to do with SEMA, public safety, the National Guard, the health departments, and bringing all those resources together that we can now do a much better job of doing testing in higher volumes, and plus what we want to call box-in testing or targeting testing, where we can assist. I want to make sure our role as the governor and our role as the state is to assist. Is to really give the support we need to be able to get the jobs done on the local level. I've kind of maintained that ever since I've been governor. We'll continue to do that. We'll continue to try to provide the resources we can. I think last week we sent like 9,000 kits up here to be tested, test kits up here. I think we got another several thousand coming in this week in this region. We now know a lot more about the coronavirus, maybe more than we ever wanted to know, all of us in this room, of what to do. But we're going to be much better, and we're going to be much more prepared. And the one thing I do want, as we move forward, there's no doubt that we've got to figure out a way to balance dealing with the coronavirus and open up the economy. Those two things have to happen. And you're seeing that now across the state. You're starting to see it here in this region of the state. But we got to do it safely, and we got to do it cautiously to be able to open up the economy and get us back to where we need to go. We are much more prepared. Let's hope we never have another outbreak of this, but none of us know for sure what's going to happen in the weeks to come. So we got to be prepared for that. I think one of the things that we've seen when we felt like our healthcare system maybe was going to be overwhelmed early on, which it frankly never did. And frankly, again, I'll give credit to the doctors and healthcare workers around the state. But the one thing we do know now, we can go out here and we can set a hospital up in 11 days, a full function hospital to fight COVID-19. We didn't have that ability 83 days ago when this all started. We do today. So when you look at where Missouri's moved, how we've handled the situation, I think we're going to find out at the end of the day, we did a much better job here in this state, and all regions as diverse as this state is, as a lot of other states have. So it's good to be back out today. It's good to be out here making sure we're trying to give the people the information they need to make sure everybody has an opportunity to be tested. One of the goals we're trying to do at this point is make sure if you want to be tested, you can get tested. And we're going to work on that as we continue to move forward. Because right around the corner, school's going to open up here just in a few months. That's going to be all a factor that's going to play in. So as much testing as we can do between now and that time, those are the things we need to be doing. So anyhow, it's good to be up here again. I want to say that. Thanks, Sam, for having me in here. Thanks for the work you and your team's doing. And thanks for your health department here. You guys have done a great job here doing what you're doing. And we're going to continue to move forward on that. So thank you all for having me here today.
We can take a few questions if you like.
Governor, can I just ask a question of you just quickly?
I didn't think any of you guys wanted to ask any questions while I was up here.
Of course not. Yesterday you talked about extending phase 1 of the recovery and the reopening plan. Just want to get your specifics on St. Louis County. I know you spoke to trying to align different parts of the state.
Right.
How concerned are you about, or are you concerned about where the St. Louis area is in terms of, is this area perhaps behind a little bit other areas? What's your take on how prepared we are to move forward here in this region?
Yeah, I think when you look at it, you gotta look at the data as a whole, as far as your healthcare system, as far as what the testing looks like. But you know, look, St. Louis area is on the right track here. We know that by numbers now. We know by the hospitalization, we know by the ICU beds, we know by the ventilator supplies, all these different things that we know we're much more prepared for that. And we continue to beef up the testing. So I think once that's gonna help to open up the economy. You know, the state of Missouri is so diverse. You know, there's different areas of the states that are much further along or never was impacted like we were in this region of the state. But the reality of it is this region was affected more than most. And we got to deal with that situation. So you can't just make a uniform policy at the same time. But I think we're headed in the right direction here. I think by opening up the business, getting people back out, getting back to work, get them a little active is a good thing right now.
Was the state of St. Louis County that we're in now a key reason for not moving into phase 2 earlier?
Yeah, you know what, we had a big weekend, we had a Memorial Day weekend, we all went through for the first time, first holiday, we're really getting into the summer, grad school years kind of finishing up, graduation, a lot of little things happen. I think again, we just cautiously want to move forward to make sure where we're at. And the reality of it is, the St. Louis region, Kansas City region, I'll say that too, you know, we just need to be a little careful here for a little while. And what I would hope, by delaying our phase is broader than this region of the state is, I think we all know that. But hopefully by the 15th, we're starting to line more up about policy and about how we're going to move forward. So I think people out there knows wherever you go in the state of Missouri, we're kind of lining up as we move forward. So that would be my goal. I've talked to the county executives, I've talked to the city mayors, and I think we're all trying to focus to that point where it's not confusing for people to go from one area to the other, what you can do and what you can't do. So we want to move forward now.
Governor, you said yourself that the St. Louis area has been more greatly impacted than other areas of the state.
Right.
The way that the Federal CARES Act money was divided created a great disparity in the St. Louis area, where St. Louis County has the great bulk of it, and the city has a very small part of it. And that's created disparities. You see some of the most vulnerable residents and businesses in the city that are suffering. A lot of those residents and businesses in the county are going to get a substantial relief through the county CARES. Do you intend to rectify this in any way?
Well, first of all, I think the counties and cities should be working together. This CARES Act money is only for COVID-19, so I don't think anybody wants to be out there in the mode of saying, hey, I'm going to be able to use that money for something else. So I think it's beneficial for the cities and counties to work together to come up with a solution. But again, I want to say, it's got to go to COVID-19, you know, so wherever that impact is, and then whatever money that's not covered when we get to that point, then we'll see what funds are available to help with that.
So if you think that there's a small business relief program in St. Louis County, should a St. Louis city business be able to apply for that?
I don't know how they're set up on how they're distributing the money on the COVID-19. I know it has to be COVID-19 related, period. So I don't even know how the distribution is to the city and the county. And look, Kansas City's kind of going through that. St. Louis is kind of going through that. There's going to be a little friction there, but you got to work through that. I mean, right now, I'm just telling you, everybody needs to be focused on what's the best thing for those citizens out there, no matter which part of the city or the county you're in. That's what we all will be focused on.
So if St. Louis City had a more disparate impact, if the virus had a more disparate impact on St. Louis City, why did St. Louis City get so much less than even St. Charles County, when the need is so much greater, the business community is so much greater? I mean,
Well,
St. Charles County,
I don't know what
looks like
St.
they're
Louis
struggling
City's
to
getting
spend.
right now. I just don't. But
35
here's what I would say. How we distributed the money was, all of it was to go to the local levels as soon as we could to help. So if St. Louis City has expenses to do with COVID-19, they're still going to be able to turn those expenses in. There may be other sources we can help to do that to COVID-19. But that first wave is getting that money out the door, really to get it to local levels to be able to utilize it.
Governor Parson, you said yesterday that you were not planning on relaxing absentee rules, but there have been a lot of people expressing concerns about getting out and vote. You even said yesterday, don't go out and vote if you don't feel comfortable. Why is there the hesitation to relax absentee rules when the alternative is not going out to vote? I mean, it seems like you want everyone to exercise that right.
Yeah, well, first of all, let me kind of go back to the question that was asked yesterday. It had to do with the June election, is what it had to do with. You know, look, when we made the decision to move the elections off in April, I don't think any of us knew exactly what was going to happen by June. I don't think any of us did. So we still have what fundamentally is in place to do absentee ballot, absentee voting, or to vote at the polls. That's still in place today. But I would never suggest, if anybody didn't feel comfortable, if they didn't feel safe going out, I would never suggest do that. I think a reporter asked me the other day at the Capitol, they was talking about dropping their kids off at a daycare center and saying, hey, I don't feel safe, my kid's dropping off at a daycare center. You know, why would you do that? So I would never, as the governor, suggest anybody harm, if they felt like they was gonna be in harm's way, to get out. I just wouldn't do that. Now, to go back to the question you wanted to know about, are we gonna change the voting process, I think for August and November, I think that's what everybody's looking at here. Yeah, we're gonna take a look at that. The legislators passed a piece of legislation, and really, I would call it absentee reform. And basically, I think the three principles in that, and again, I don't have that in front of my legal team's looking at it right now, but you actually, part of it would be much like we do the military. You would be able to get a ballot, you'd have to have it notarized, and you'd be able to mail that in. If you're 65 years and older and you have health conditions, you'd be able to request a ballot to your address to come there. And then third, that the provisions would all have a sunset provision at the end of the cycle. So it takes care of the pandemic that we're in as far as COVID-19. So I think there will be some changes made to that on that particular issue. And I think that's just common sense stuff. And I think, but you got to protect the integrity of the vote, and you got to protect the voter. You do. So I think I would never insinuate people shouldn't go vote, because I fundamentally just believe that's who we are. But I would never either tell anybody to put themselves in harm's way if they really felt that way of going out. I wouldn't suggest do that.
Governor, to follow up on that,
Yeah.
if you do sign that bill,
Yes.
which you said you're going to decide on potentially next week,
Yes.
St. Louis County had 76,000 applications for a municipal election. It stands to reason if you sign that bill, there could be, the number could be a lot higher, not only in St. Louis County, but everywhere throughout the state for absentee balloting. Do you think that the legislature will have to allocate more money to local jurisdictions to help pay for the extra cost of absentee ballots?
Yeah, you know, Jason, the Secretary of State probably better to answer that on that. I mean, look, what we want to do is we got to make a decision on that simply to get the absentee, to get the process in place by August. So that's why we got to make the decision pretty quickly next week. Frankly, I got to make that decision. And again, I want to be clear on that as I speak about that. That's in legal counsel right now, and we're making sure everything's what it's supposed to be in that legislation. But you know, whatever the cost of it is, again, I'm going to be careful what I say here, but I'm going to say even if the cost is driven by COVID-19, which I would make a case it could be, then there probably could be funds that could be utilized for that. You know, but again, I'm telling you that off the cuff here a little bit without going through the people that really knows how that money's out. But if we go down that road, we want to make sure the availability of the cost of that, we can take care of that and make sure people can go vote.
Going back to the stay-at-home order for the statewide, one of the things that is notable about yours is it allows counties like St. Louis County to have stricter guidelines than the state.
Right.
And if you listen to the public forum of the St. Louis County Council, a lot of people are really upset about how more stringent the counties is than the rest of the state. What message would you have for people that are upset that the county is more stringent than the state? Because people like Dr. Page would say, this is the epicenter for COVID-19. We have to have a different set of rules and guidelines than the rest of the state.
Yeah. First of all, I've always been a huge supporter. I believe in the local control. I have ever since I've been involved in this arena. I have ever since I've been the sheriff of that. But you can't pick and choose when you want local control. And people have to understand, you know, that's why I've been in my role as governor. I don't like the federal government coming in and telling me what to do as a governor. I don't want to be telling these cities and counties exactly how to run their business. You know, they know better on the ground here. And the other thing, they're elected. You know, there's consequences to elections. You know, we're all responsible for what we do every day as elected officials, and I think that's why voting is so important. That's why those decisions we make, for when they're good decisions, when they're bad decisions, that you're judged upon them. But you know what? I'm trying to govern the entire state of Missouri, and what happens in Douglas County, Missouri, is much different in St. Louis County. And so people on the ground have to make those decisions. And so I know people sometimes would like me to come in and step in and say do this when they want it. But I could also go back to the case of saying our policy was different than the St. Louis region when stay-at-home orders. You know, do you want that or do you not? So I mean, it's a balancing act you got to do. But for me, I'm always going to be supportive of the local control. As long as they can handle it, my job's going to be to support it.
We'll take one more question for the governor.
Governor, how concerned are you, I'm sorry,
I can ask Dr. Page.
How concerned are you, Governor, that you can see more scenes like what happened at the Ozarks over Memorial Day weekend going forward here, heading into the summer? How do you stop that from repeating? 'Cause you've been clear that you want to move in and take over statewide. How do you stop it?
Yeah, I don't know that you do stop it. I don't know that you do. I mean, the reality of it is, at some point, people's got to be responsible for their actions. As I said yesterday, you know, I can tell people all day long till I'm blue in the face to stay social distancing. And I say that almost every day in my briefings. But at the end of the day, people's got to take it upon themselves to do that. There's not enough enforcement agencies, nor do we live in a police state where we can do that, where we can force everybody to stay 6 feet apart. We ask them to do it, and I think it's important, though. The incident at Lake of the Ozarks, you know, national attention, it was the big issue in the media and everything else. The reality of it is, vast majority of the people were doing things right. Even at the Lake of the Ozarks, besides that area, there was people down there enjoying the weekend, trying to do the right thing. So, you know, it's unfortunate. I wish it hadn't happened, and I hope the people understand the risk they take by doing that and what that really does to somebody else that none of us may never know. But I don't think you're ever going to be able to go down there and control that at some point. We're right now trying to figure out, how do you open up the economy? How do you still deal with the virus? And there's going to be instances like that from time to time. We're just going to have to figure out, you know, as we move forward, will we deal with it? I mean, if it continues to be a problem, there's certain actions we can all take. All right, thanks everybody for having me in here this morning. Appreciate it.
Dr. Reed, could I follow up and ask a question for you?
Sure.
Ask that last question for Governor Person. I'm just wondering, we're seeing all of these images coming out of Minneapolis this morning, and it's causing concern for a lot of people here as well. What plans, if any, are in place, and how are you going to make sure that things don't get out of control this weekend? Protests were planned yesterday, and we have the rain. It's supposed to be a beautiful weekend to get outside.
Well, first of all, I think we have to recognize that that our police officers have a duty to keep us safe. And sometimes that can be difficult. We expect them to have the proper judgment and discipline to make good decisions. And we are obligated to provide them with the training so they'll be able to react to any situation.
Have there been any specific proactive measures that have been put in place or that are going to be put in place to make sure that something like that doesn't happen in St. Louis? Because in Minneapolis, they didn't know that it was going to get nearly as violent as it was. That happened on the second day, kind of in the second wave of protests.
So our police department monitors this on a regular basis. Our emergency operations monitors these things. When our police officers don't meet our standards, we expect them to be held accountable. That's the message we've always had to the community. That's the relationship we have with our community, and we'll keep those communication pipelines open. If people want to protest peacefully, I'm sure that we will support that, and we will provide them with the support that they need. If that turns into something that's less constructive, then we'll react appropriately. I'll leave that to our county and municipal police departments. We certainly are monitoring the situation, and will continue to do so. We hope that everyone can learn from what is clearly a tragic event, and that we can move forward as a community, as a country. Watching that video was horrifying for everyone who saw it.
Dr. Reed, I'll ask a similar question.
This is going to be the last question, by the way.
I'll ask a similar question to what I asked the governor. One of the hallmarks of this stay-at-home order allows counties like yours to have more strict guidelines in the state. What do you say to the people that you've heard from the county council meeting who are upset that it's more strict than the state standard?
So the question is, why is the state, why does St. Louis County have a more strict standard than the rest of the state? And what do I say to people who have concerns about that? I would say that St. Louis County is a different situation than the rest of the state. We know we have more cases, we know we have more deaths, and we know we have just a bigger impact. We have more nursing homes, so we're watching our nursing homes very closely with an extraordinary effort by our Department of Public Health. We just have a completely different situation in the St. Louis region, especially St. Louis County, than the rest of the state, and it's appropriate for us to have different standards and guidelines as we move forward. We expect by the middle of June that just about all the remaining businesses and venues will be open with restrictions and guidelines by the middle of June. and that, you know, sometime through the rest of the month, we'll be on a similar track with the rest of the region and the rest of the state. But we'll just have to see how it goes. We're going to watch the data. We will always make decisions in St. Louis County based on data from our public health officials, from our public health experts, recognizing that we have a different situation here than the rest of the state. Okay, thank you, everyone.